Inside Texas Politics, 3rd edition, chapter by Rottinghause, chapter 14, part 1, Public Policy in Texas. Some have called it the Silver Tsunami. By 2030, almost 20% of the state of Texas will be over 64 years old. And currently, about 10%, almost 3.5 million, live in poverty, a number that is expected to grow. Low income makes seniors vulnerable to hunger and abuse in shady living facilities, conditions exacerbated by the spread of infectious diseases. Hidalgo County, with its more than 86,000 Latinos over the age of 64, is home to Linda's Momentos Adult Daycare. In Magallan, it's like our second house, says one guest who joins others to gossip, eat, and listen to telenovelas. The group is part of an estimated 34,200 elderly Texans statewide who utilize day activity and health services. The name state officials give to adult daycare. Most access these facilities using joint state federal social service programs like Medicaid, as the cost of elder care and the health needs of Texans rise. State and federal policymakers will need to find ways to meet the demands of changing population. In this chapter, we outline the policy-making process that builds concrete solutions for problems or concerns that face aging and all other Texans. We then take a close look at the dozens of policies created and administered by the state and examine where Texans stand on health care, welfare, education, transportation, energy, and environmental policy. Confrontations over these issues divide along familiar battlefronts: partisanship, geography, and economic interest. 14.1 Public Policy Priorities and Process. Texas has a long history of being a low-tax, low-service state with no income tax. Texas support for social programs is generally low. Texas consistently spends less per capita, about $4,024 per person in 2018, than 49 out of the 50 states. Expenditures are an indicator of state priorities. The result of the pull and struggle of competing interests, however, produces a budget that reflects not only what Texans want to spend money on, but also what Texans must spend money on. These obligations are as plentiful as tumbleweeds in western Texas or taco trucks in Austin, and they involve all Texans: the elderly, the young, the disabled, the sick, the impoverished, and even those stuck in traffic, because the responsibilities of education and public safety are delegated to the state. Texas spends most of its revenue on these policies and programs. Like debates over the best Texas barbecue, the policy-making process is a cycle that never ends. See figure 14.1. A triggering factor and issue on the agenda, the problem is studied and solutions are proposed and implemented, but that's only the beginning. Texans then begin to argue over where the policy is working and where it is failing. Using research and feedback, lawmakers revise the policy. Let's take a closer look at the four prominent moments in this complex process, using the recent open carry debate as an example. Everyday needs of the people, as well as sudden crisis such as economic shock, a natural disaster, or massive failure, trigger the policy-making process. Citizens who have problems, interest groups, or political parties often identify issues they would like to place on the agenda. These individuals or groups frame the problem by identifying the causes and consequences and by attempting to control the narrative on the issue. In one case, at the dawn of the 2015 legislative session, Second Amendment supporters held a rally at the state capitol advocating for open carry, a provision that allows properly licensed individuals to display a firearm openly rather than concealing it. In Texas, when murder occurs every 7 minutes and on, in 2014, 63% of these homicides involved firearms. Some Texans argue that open carry deters crime. Texas was at the time one of only 6 states that did not allow it. Advocates for open carry also claimed that concealed carry restricts their right to bear arms, and that given recent mass shootings like those that have taken place in schools and movie theaters, Texans should be allowed to carry weapons openly. Organizations like Open Carry Tarrant County pressed lawmakers for support, who in turn confronted other reluctant lawmakers in their offices. During the agenda-setting phase, policymakers asked, is this problem important enough for government to get involved? Lieutenant Governor Dan Patrick had pledged support for the open carry issue. But when the early days of the legislative session passed without action, Republican Representative Jonathan Stickland stated, if Dan hasn't had anyone bring this issue up to him, let me make it clear. If I am bringing it up to him now. Policymakers then examine the problem to understand whether and how government can offer a solution. They gather information, meet with experts and Texans who are connected to the problem, and consider alternatives. In the policy creation stage, stakeholders from around the state shape legislation for the open carry debate. Municipal and public safety employees weighed in on where gun-free zones would begin and end. Private corporations expressed concern about negative consequences for tourism and retail. In the policy adoption phase, lawmakers adopt the policy, appropriate funds to pay for the policy if needed, and set rules for implementation and guidelines for review of the policy. In the open carry debate, lawmakers grappled with how to protect search and seizure rights guaranteed by the U.S. Constitution to individuals who openly carried and were detained by police, called cop stop. The Texas legislature opted to strip these measures, describing police procedures from the bill. As the bill passed, law enforcement in San Antonio had to develop policies to handle those who might open carry at Fiesta, the annual citywide event with parades, rides, and attended by more than 3 million people. In the final phase, evaluation, lawmakers and other experts review the policy and its outcomes. The final phase comes later in the form of oversight, hearings, guidance, documents, and, if needed, revisions to the policy creation or implementation. 6 months after open carry went into effect, gun rights advocates complained that guns were still being banned in places where the law should protect the right to open carry, including jails. Many questions remain where churches and other private religious institutions also required to abide by the new law. Attorney General Ken Paxton penned a clarifying, non-binding legal opinion that it is legal to carry a loaded gun into a church as long as there were no signs banning weapons. 14.2 Healthcare and Welfare. Many Texans are just one crisis away from financial disaster, and nearly a quarter of Texas children live in poverty. Poverty rates for African Americans and Hispanics are nearly 3 times higher than those for Anglos or Asians. Geography matters as well. Although poverty rates in Texas have fallen, Texans along the border are more likely to be in poverty than the rest of the state, more than 40% versus 15% statewide. 1 in 7 Texas families is food insecure, facing hunger, or engaging in coping mechanisms to avoid it. On healthcare issues, Texas has the biggest share of uninsured of any state in the union, both as a percentage, 18%, and in more than 5 million residents in 2018, surpassing even California and well above the national average of 9%. How does Texas address these issues? One path is a redistributive policies that transfer wealth from those who have more to those who have less. Generally, social welfare programs pull taxes from working Texans to return them if and when Texans need assistance in the future. Like other Americans, Texans can receive health insurance as a benefit through their employers' purchase private plans or qualify for government health care programs. These programs include Medicare, Medicaid, Social Security, and the Children's Health Insurance Program. Federal and state governments fund these programs jointly, which allows each level to have input in determining the scope of the program and illustrates how federalism, discussed in Chapter 3, works today. As federal funds are freed up, either through the reduction in need or stricter state rules, state lawmakers can shift funds to other programs like facilities, mental health hospitals, or child protective services. Medicare. When you hit 65, you will be eligible for Medicare, a national social insurance program for older Americans funded by payroll, tax premiums, and surtaxes, and administered exclusively by the federal government. Medicare only partially covers healthcare expenses depending on the specific plan, and so it leaves some Texans to pay the remaining costs. As of 2019, more than 59 million Americans and about 4.2 million Texans were beneficiaries of Medicare. Although Medicare is a wholly federal program, federal law does require the state to pay deductibles and premiums for low-income Medicare beneficiaries. Critics charge that Medicare is inefficiently managed, gives inadequate access to medical providers, and is wrought with fraud. The government routinely tracks down and prosecutes fraud. The largest Medicare fraud enforcement action in history netted 35 doctors, psychologists, and nurses charged with stealing more than $1.3 billion in 2017. Medicaid. Medicaid covers more than 4 million Texans who have low income. Established in 1967, it is administered by the Texas Health and Human Services Commission. Medicaid is a basic health insurance program that covers both acute care, such as visits to the doctors, and chronic care or long-term services. This program increases the role of the national government in the states, especially Texas. Because of the state's large low-income population, the federal government determines specific eligibility rules and picks up most of the tab. While the state must administer the program and can expand eligibility, essentially the federal government sets the table and cooks the meal, but the states must serve it. Federal law requires the state to cover certain population groups, such as the disabled, low-income families, and children based on income levels, but it gives the state the choice of whether to cover other population groups, such as pregnant women or infants, up to 198% above the poverty level. The state also gets to decide what services to provide to these populations? Should it give the mosquito repellent to pregnant mothers to prevent the Zika virus from infecting the child? Texas covers home health, lab, and x-ray, well baby, and well child care. Optional coverage includes eye care, podiatry, hearing aids, mental health counseling, and hospice care. The number of Medicaid recipients is double today what it was in 2000, as the number of poor Texans has expanded, covering 14% of Texans in 2019 and growing by 35% from the prior year. People enrolled in other low-income programs automatically qualify for coverage. The current Medicaid caseload is composed primarily of pregnant women, 69% of total clients, and Texans under 21 years of age, 77%. Families with non-disabled children make up 69% of the program participants. Texans with disabilities make up more than half of the total Medicaid spending statewide. In 2019, 50% of Medicaid clients were Hispanic, 18% were Anglo, and 15% were African American. Because a large percentage of individuals in Texas are in need of coverage, and because federal and state laws do not limit those eligible, Medicaid in Texas is on an unstable budget trajectory, as rising healthcare costs and growing enrollment consume on an ever large portion of the state budget. Excuse me. Texas also spends more on Medicaid than on any other program. However, most of the funds are provided by the federal government. The federal government funded almost 60% of the Medicaid program in 2019, and Texas the other 40%. Texas spending on Medicaid in the 2020-2021 budget, making up more than 29% of the budget, surpassed education spending. The state is allowed to add but not subtract individuals with specific needs to Medicaid, but this is less likely as the budget grows larger. Children's Health Insurance Program. The children can also get special health coverage through the Texas Children's Health Insurance Program, CHIP, a federal program that is run by the states to provide health, including dental coverage, to children whose families make too much to qualify for Medicaid but not enough to buy private insurance. Like Medicare, the federal and state governments share the cost for the program. The federal government picked up 70% in 2019 to the state's 30%. The state has more than 500,000 children in CHIP. Medicaid combined with CHIP covers more than half of all children in the state and 2/3 of people in nursing homes. Funding for the 2020-2021 budget allocates about $200 per child per month to the approximately 425,000 eligible Texans. States have flexibility in designing their CHIP program. Texas program expanded their health insurance to children and families that earn up to 200% of the poverty line. Eligibility rules also require a child to be a Texas resident under age of 19 and uninsured for at least 90 days. Immigrant children were formerly ineligible for CHIP. However, rules changes in 2010 enabled the state to receive matching funds from the federal government. And so Texas extended the coverage to some of these children. The Patient Protection and Affordable Care Act broadened federal funding for CHIP, prevented states from reducing certain eligibility standards, and required states to continue current levels of coverage. The Affordable Care Act. The Patient Protection and Affordable Care Act, commonly referred to as the Affordable Care Act, ACA, or Obamacare after President Barack Obama, who championed the program, allows states to expand Medicaid coverages to families with incomes up to 133% of the federal poverty level and provides insurance subsidies for families with incomes between 100 and 400% of the federal poverty level. The catch is that every individual who was not covered by their employer's plan must buy insurance or pay a fine. After the ACA was implemented, the national uninsured rate fell to 11% in 2015, the lowest recorded percentage in 2008. More than 1 million Texans enrolled through the national exchange and received subsidies averaging $333 per month to help pay for their premiums in 2018. Approximately 1.7 million Texans could purchase subsidies, policies, and under the ACA, Medicaid, or CHIP, but aren't doing so. Many Texans don't understand that they are eligible, which researchers chalk up to confusion that could be solved through outreach and education. Because Texans did not expand Medicaid under Obamacare, however, the state has 638,000 adults who fall into a coverage gap. These gappers earn too much to qualify for Medicaid, but not enough to qualify for marketplace tax credits. The struggle between the federal government and Texas continues over future health care funding. The federal government encouraged states to join the ACA, but Texas has been reluctant to do so. The state was able to secure a waiver called a Section 115 waiver until 2022 to help Texas privatize its managed care health insurance system for Medicaid patients and tamp down the exploding cost of uncompensated care. Texas agreed under the temporary waiver to develop a Medicaid expansion program. Meanwhile, during the first 2 years of the Trump administration, Congress attempted but failed to repeal or replace the ACA. President Trump rolled out a series of actions to cut the enrollment period and reduce funds for those eligible for coverage. Social Security, a rising urban population, the fragmentation of Americans, extended families, and an increase in life expectancy, combined with the crippling effects of the Great Depression, prompted President Franklin Roosevelt to Congress to enact the Social Security program in 1935. Run by federal government and administered through the Social Security Administration, working Texans pay Social Security taxes, and the federal government sets aside funds to help the blind and disabled and those with little income. In return, Texans receive Social Security payments when they reach the age of retirement, a sliding scale from 62 to 66, or Supplemental Security Income, SSI, if they become unemployed or disabled and are age 65 or older. The federal government sets eligibility caps and benefit rates and determines eligibility. Currently, about 1 in 7 retired Texas residents receives benefits from Social Security, about $1,290 per month. A Social Security is especially important for retired Hispanics. Almost 3/4 of Hispanic beneficiaries nationwide rely on payments from Social Security for at least half of their retirement income. In contrast, Social Security payments make up only about 1/3 of the retirement income for non-Hispanic Americans. This is because elderly Hispanics are more likely to live below the poverty line, 18%, than other groups, 17% of African Americans, 9% of Asians and Pacific Islanders, and 7% of Anglos. Through SSI, blind, disabled, or low income aged Texans received $750 per month per individual in 2019 to meet basic needs like food, clothes, and shelter. Many states supplement SSI. Texas does not, but it does require a smaller percentage of one incomes to automatically go to healthcare costs compared to other states. Temporary assistance to needy families. Several joint state and federal programs help Texans make ends meet. Tested programs are income measured programs that provide aid to Texans or communities with low incomes, usually headed by a single parent household. The federal government pays for these welfare programs, and any Texans who qualify can access them. These programs consumed $1 trillion of the federal budget in 2019. The largest welfare program is Temporary Assistance to Needy Families, TAMP, a block grant to states. The federal government sets the basic rules, but the states develop the specifics of the programs, including eligibility limits and benefits levels. TAMP provides financial and medical assistance to needy children and their parents or the relatives with whom the children live. TAMP also offers one-time assistance payments of $1,000 to families in need to help solve a short-term crisis. To be eligible in Texas, the head of the family must receive job training or seek employment, follow child support rules, not quit a job while receiving funds, not abuse alcohol or drugs, take parenting classes, and get vaccines for their child. The number of families receiving TAMP in April 2020 was 16,647, down from the more than 50,000 in 2008. It is difficult to get these benefits in Texas because the state has placed caps on how long a family can obtain benefits and has instituted strict income eligibility rules. To qualify for a maximum $290 a month in monthly cash aid, a family of three cannot make more income than $188 a month, a rate that has been frozen for 20 years. Thus, only the most destitute families qualify. For every 100 poor families in Texas in 2016, only 4 received TAMP, compared to 23 nationally. In the past 20 years, TAMP subsidies have dropped significantly in every state, leaving families who received TAMP well below the poverty line. See figure 14.2. Feel free to pause for 14.2. The one-time TAMP for grandparents program offers $1,000 to grandparents if they have grandchildren on TAMP and don't have significant assets or make more than twice the poverty level. Unemployment benefits. Texans who are temporarily out of work through the no fault of their own may qualify